So the clinical trial currently is open and enrolling at The Ohio State University. Currently we are in the safety phase, and so the initial part of the clinical trial is evaluating the safety of gemcitabine along with these natural killer cells. Currently we have enrolled 2 patients on the safety cohort, and our goal is to get either to 3 with no toxicities, or if there is a dose-limiting toxicity in the remaining patient to be enrolled, then we would expand to 6. Once we're able to demonstrate safety with the combination of gemcitabine and these natural killer cells, we'll then look at the persistence of the natural killer cells in the peripheral blood of the patients on the trial. The reason why this is important is because natural killer cells have not been commonly used in solid tumors. And so when they have, typically we've used a very cytoreductive regimen like they use for T-cell therapy or bone marrow transplants. However, with natural killer cells, they tend to augment chemotherapy, and so rather than completely depleting the patient's immune system, we just want to make sure that these donor natural killer cells are persistent. So once we're able to demonstrate persistence in those patients that are in the safety cohort, we would expand then by another 3 to 6 patients in which Naxitamab then would be added, and so the safety of the 3 agents would be assessed. During this time, we're also looking at signs of efficacy. Once we determine whether it's the doublet, so gemcitabine and natural killer cells, or the triplet, which is the gemcitabine, the natural killer cells, and then Naxitamab, once we determine which is the safest, as well as which combination leads to the best NK cell persistence, we'll then expand further to look at efficacy. The initial efficacy is using a Simon 2 stage, and so we'll be looking at a small patient population to see if there's a sign of efficacy. If there is, we would then ideally and then expand to a larger phase 2 trial. In this clinical trial, we'll be assessing the combination of gemcitabine with the TGFβ-imprinted NK cells, and then potentially with Naxitamab, an anti-GD2 antibody, in patients with metastatic HER2-negative breast cancer. This clinical trial is open to patients with both triple-negative breast cancer as well as hormone receptor-positive HER2-negative breast cancer. And these patients need to have progressed on at least 1 line of therapy in the metastatic setting. Patients also are eligible if they're male or female, so open to all patients and above the age of 18.